covering the stories that impact your life, your town, your state, and your future. This is the Means Report with your host, Brad Means.
Hello, everybody, and welcome once again to the Means Report. We certainly appreciate you spending part of your day with us, where today we are going to focus on two big issues: your health and agriculture, especially when it comes to the future of the ag business. We have some up-and-coming leaders on the Means Report to talk to you about what they're up to. But we're going to lead off with how healthy are we these days? And of course, you see there, we'll tell you how to stay in touch and help us get more great guests like Dr. Biplab Datta. Dr. Datta, kind enough to come back to the Means Report and talk about his annual Georgia Health Report. It's called Healthy Georgia. Great name for a report that really takes a look at all things that concern our health, whether it's diseases or other conditions, prevention for sure. And it's done by our friends at AU's Institute of Public and Preventative Health, an annual publication, Healthy Georgia. Dr. Datta, thanks for coming back and thanks for breaking this down for us.
Thank you for having me.
All right, so let's just say there's some people out there who missed our get-together 12 months ago. Just a general question: what is the Healthy Georgia Report? What's in this book?
It's basically, you can say, a report card of how well we are, like you said. But the important part of it is to compare how we stand with the rest of the US and the rest of the southeastern region. And not only in terms of overall prevalence, but we do some nuance by socioeconomic conditions, by sociodemographic conditions. For example, if someone with black race in Georgia, whether they're doing better or worse compared to blacks in the rest of US. So not only just overall, but with more nuances across different socioeconomic status conditions.
Where do you get your information? Do you have volunteers who you study? Are there other sources?
No, we basically rely on nationally representative survey from the U.S. Centers for Disease Control and Prevention, CDC, so BRFSS to be exact. But we also look for some other sources like American Community Survey. So whichever data sources that have national level data across different states, we utilize those data sets for our analysis in this report.
Okay, I understand. Well, you touched on this in your first answer, but just to be clear, the comparison with the populations that you study is to the rest of the nation or just the Southeast? How, Georgia versus the Southeast or the country?
Both. So we compare whether we are at comparable rates with the national average, and we also compare how well or worse we are doing in terms of southeastern average. But in this year's reports, we add something more. So now we also highlight our neighboring states. So South Carolina, North Carolina, Florida, Alabama, and Tennessee. So we are trying to provide a snapshot how we are also doing in terms of our neighbors.
All right, so we'll get into the specifics of what you learned, but just again, as a general question to get things started, why should lawmakers pay attention to this and policymakers? What can they learn from it and what could come from it that might benefit us health-wise?
So what we see, there is some kind of gap between the researchers, public health practitioners, and the lawmakers. So this report is trying to connect the bridge between these different entities who are all important pieces of public health. So lawmakers, policymakers, by looking at this report, can identify areas where we are lagging behind, where more research is needed to inform appropriate policies. So it will link policymakers with researchers to provide them with more information so that they can strategize on accurate policies that needs to be implemented to make our state a better place to live.
Bottom line, could that possibly mean more funding for Augusta University and the folks in the research department?
Actually, not for Augusta University, but the whole research community within the state of Georgia. It could be Augusta University, it could be UGA, it could be Georgia State, Emory, or any other institutions. But all we need to understand from the policymakers' perspectives, the areas that needs more attention. And maybe we are good at in some areas, Emory may be good at in some other areas, UGA may be good at in some other areas. So we need funding coming to areas where we need more research and intervention, and not only Augusta University, but all the academic institutions within the state of Georgia.
Anything jump out at you this year? Any new findings from the 2024 report?
We added a an important piece in this year's report, that is overdose deaths. And what we find, like Georgia has one of the lowest overdose rate in the country. So we only have data for 30 states, and including DC.
And we're one of the lowest when it
One
comes
of the
to
lowest,
it.
it's sixth lowest. So that's
Okay.
good. But what is important, we have to continue the good work so that like the epidemic of overdose death is not expanded, so we can contain that and we can improve from 6 to be number 1 lowest. So that should be something we should look forward to.
All right, so continuing to focus on the good news or the encouraging news, other health categories where we look okay in the state of Georgia versus other parts of the country?
So like in general, what we see, we are, in many cases, we are comparable to the national average, but we are kind of doing better than the southeastern regional states. So that's the good thing. But there are some issues like we need to focus, particularly in the aftermath of the COVID-19 pandemic.
Right, I was going to ask you about that.
What we are seeing is there is a surge in obesity prevalence in the country, in the Georgia, and that is higher than the national average and also higher than the southeastern regional average. And alarmingly, we see individuals who are younger adults, aged between 18 to 49 years, they had a higher prevalence rate of obesity compared to this age group in rest of the US and also rest of the southeastern region. So that's something we have to think of. Also, lower middle income households that has an income of 100% to 200% of the federal poverty line, they are also having a higher prevalence of obesity. So we need to figure out like why it's happening. Are we eating less healthy? Or are we not complying with the physical exercise recommendations from the CDC? So this particular thing, I think, need more research to figure out what are the underlying causes.
Well, do you have any indications here in the early going as to why this might be happening? You know, and I'm not trying to be funny, but it seems like everybody I run into is on Ozempic or one of those weight loss wonder drugs. And I know that obviously, you know, low-income families don't have access to the areas of healthcare that others do. But any indication as to what's making people overeat or become obese?
One thing in Georgia, and a few of my colleagues at the August University is also researching on it, we have certain areas, those are food deserts or food swamps.
Right.
So we don't have access to healthy grocery or nutritious meals for all the Georgians, particularly for example, in Richmond County, where August University is situated,
Exactly.
we don't have a grocery store in walking distance.
There's nothing.
Yeah, there's nothing. So maybe that can be one. And also, like I said, the transition from COVID-19. So lots of us are used to working on at home and not going out more frequently. So that may be one of the things. We are not physically that much active nowadays. So it'll be a combination of different things, and that's why more research is needed, like why we are doing bad in this particular area.
What about cancer rates? Anything jump out at you when it comes to cancer?
That's something, a surprising finding of this report. So what we are seeing in this year's report, Georgia has one of the lowest prevalence rates of cancer. But if we look at the incidence rates from other data sources, Georgia has one of the highest cancer incidence rates in the United States. So it doesn't match up, like why we are seeing a smaller prevalence, but we know the incidence rates are higher. So that's another area where we need more research, because there could be one particular thing. Maybe our incidence rate is higher, and we also have a higher mortality rate out of cancer. Maybe we have a lower survival rates. And prevalence is actually the prevalence of cancer survivors. So in the data, we may see the lower prevalence because of higher mortality rates or lower survival rates. So this is an issue. I think folks in the Georgia Cancer Center will definitely have a look, and we need more research, more insights on this particular issue, why we see the mismatch.
Yeah, that's scary if you consider fewer people get it, but those who do die faster.
Yeah.
Let me take a look at what we can do at home. And I was going to ask you this when it comes to obesity, but I know we're still in the early stages of studying why those rates are where they are. But just from a general health perspective, what can moms and dads and caregivers do, not only for their own health, but to make sure the family is as healthy as possible?
I think we Southerners are always inclined to more like fried foods, and
We love them.
we love them. So I know we can always have them once in a while. But in our regular diet, we need to introduce more healthy options. So that's the number one thing, and low cost thing I think we can do. And on top of that, some other issues directly not related to obesity, but other cardiometabolic health conditions like hypertension, diabetes. So if we can cut down our sodium consumption, if we can cut down our sugar consumption, that will definitely help. And we need to make people aware of these low-cost preventive measures that they can easily take. So healthy diet, and another thing, like I said, like we can always go out, have a walk, have a run, and 150 minutes per week, that's the recommended physical activity recommendation from the CDC. If we can adhere to that, I think those low-cost preventive measures can help us.
Did you say 150 minutes a week or 50?
150 minutes.
150?
Yeah.
And you can spread that out over the whole week?
Yeah.
Let me ask you about, we have about a minute left, when it comes to schools, and this may be outside of your area of expertise, but I go to a lot of schools each year, and it seems as if more and more schools are serving healthy options in the cafeteria, in the vending machines, you name it, it's gotten healthier.
Yeah.
Are you seeing that in our schools? Are they doing their part to keep Georgians healthier?
I do not have personal experience on that, but from the overall literature that I have reviewed, when schools stopped serving sugar-sweetened beverages, so like that has some impact on a healthier outcome in students. So like definitely better beverages, nutritious options, that will definitely make students more healthier in our schools.
A shout out to the dietitians and nutrition experts in our schools. They are tireless and they do a great job with their efforts to help our youngsters. Dr. Datta, thanks again for working on the Healthy Georgia Report 2024. In many areas has been an encouraging year. And we certainly will look to build on that and get you back for your next publication.
We'll look forward to that. Thank you.
Me too. Thank you so much. When we come back on the Means Report, we're switching our focus to the world of agriculture. Some experts have made the journey from McCormick to be on the Means Report.